September is Sepsis Awareness Month. That's because it is the leading killer of patients in hospitals in the U.S. And hospitals across the country, including Munson Medical Center, are doing what they can to keep patients healthy. Michelle Dunaway shows us how in today's MedWatch.
81-year-old Jerry Lesney spent 35 years serving his country in the U.S. Air Force, but it was illness that almost took him out.
And I got these really bad chills, so I started putting on a sweater and stuff, and I went to bed. And I had about 3 blankets on, and I was just shaking like crazy.
Jerry listened to his body and got to the doctor.
They took all my vitals, and they said, "Now take him to Munson Emergency."
A decision that likely saved his life.
Within 10-15 minutes, I had IV put in me and that, and then they put an IV in my neck. I was 7 days in the hospital.
Jerry had sepsis.
Sepsis is, in a sense, an infection that sets off a chain reaction in the body that no longer helps us fight infection, but begins to work against us.
Dr. John Kirchmark is the medical director of the Sepsis Initiative at Munson Medical Center, a program started out of sheer need.
Well, sepsis is unfortunately not uncommon. You know, the annual incidence is well over 1.5 million people in our own country, and we see it locally. There's been an international effort because of how common it is and how deadly it actually can be, that it is probably the most common killer of people in a hospital setting.
Certain people are more susceptible to getting sepsis, like the very young or the immunocompromised. Diabetics and those over 65 are also more at risk, like Jerry. But no one is immune.
In general, the earlier you identify an infection, the better, because infection can begin as just that, a localized infection. But if it goes on untreated long enough, anybody can develop sepsis.
That's why Munson Medical Center and other hospitals across the country are taking steps to hopefully cut down on the number of patients getting sick.
Things like removing unnecessary lines that are no longer needed that pose a threat for colonization of bacteria, hand washing, mask use, so that we're not spreading germs, so to speak, from room to room or patient location to location.
Today, Jerry is feeling himself again and has advice to others who might be experiencing the same kinds of symptoms.
If you try and think you're going to fight it yourself, this disease takes over. You better get some help, but I mean fast. It's not like days you think you're going to beat something. Well, you're not going to beat it.
For MedWatch, I'm Michelle Dunaway.